because we took one without a head.
Of course.
Sorry, I'm all like in your
Oh,
face.
no, it's fine. I feel like I'm at a Backstreet Boys concert, circa like 1997. You could share a seat with me.
I'll try. Thank
Just
you.
put a cheek.
All right, so starting from the arch of the aorta, right here, right, we have three branches, the brachiocephalic trunk, left common carotid, and the left subclavian. So here's your clavicle, your landmark, to differentiate the subclavian artery from the subclavian vein, which is not shown here. And I'll show you when I do the upper limb. Now, coming down through the thoracic area, we have the thoracic aorta, and we can also see the pulmonary arteries and the pulmonary veins. Coming through the diaphragm, that's the principal muscle of respiration right here, our first stop is the celiac trunk. So I'm pointing to the center of these three vessels. The celiac trunk gives rise to the left gastric here, the splenic beneath it, and the common hepatic on the right side. Again, left gastric, splenic, common hepatic. Inferiorly to that, we have the superior mesenteric here with the left renal vein, right renal artery, right renal vein, and the abdominal aorta, and the inferior mesenteric. Superior mesenteric, inferior mesenteric, and then the abdominal aorta splits to become the left common iliac, right common iliac, and then it's going to split again to become the external iliac here, internal iliac here, and as we follow the external iliac, coming through the inguinal ligament, it becomes the femoral artery right here. So let's back up and take a look at the celiac trunk here, the superior mesenteric here and the inferior mesenteric here. So we'll put the large and small bowel. Now the small bowel is framed, this is the small bowel, it's framed by the large bowel here, which includes an ascending, a transverse, and descending. So it sits in the abdomen, you have the right side and you have the left side. And so that's going to help us identify the vessels on the right versus the left. So from the superior mesenteric, we have the middle colic, that first division right here, the right colic, the ileocolic, and the intestinals. On Blackboard, I have a detailed picture from Frank Netter of the blood vessels of the stomach and bowel. So if you go on Blackboard, you'll see it. Middle colic, right colic, ileocolic, intestinals. Same order I have on the sheets I gave you. Now, from the inferior mesenteric, we have the left colic, sigmoid for the S shape, sigmoid colon, and superior rectal. So this is heading out towards the superior rectal area. Now, the stomach. Now here we have the left gastric, splenic, common hepatic. This is the esophagus, and the stomach would sit in the abdomen just like that. So from the left gastric, coursing over the lesser curvature, we have the left gastric, the right gastric, and that's going to give rise to the gastroduodenal that comes off of here to join the common hepatic right here. So you have this little loop of left gastric, right gastric, gastroepiploic, common hepatic. Left gastric, right gastric, gastroduodenal. Now, on the greater curvature, this is the greater curvature, you have the gastroepiploic. Here's the gastroepiploic, and it's the same with left and right. Left gastric, left gastroepiploic, right gastric, right gastroepiploic, and this is coming off of the splenic artery. Again, here's the left gastric, splenic, common hepatic, superior mesenteric, inferior mesenteric. You could also see the intercostal artery in red, the intercostal vein in blue, and this is an intercostal nerve in gray. Now, the upper limb coming off of the subclavian, here's the clavicle, there's the subclavian artery. We're going to go to the upper limb, and of course you took a limb without a axillary vessel. So here's our clavicle, right? Our clavicle. So on one side we have the subclavian, on the opposite side we have the axillary, and then over the humerus we have the brachial artery, and the brachial artery is going to split, and so we'll find the radial bone. There's the radial artery. We'll find the ulnar. This is the ulnar artery, and there's the palmar arch, because this is the right limb. Again, subclavian, axillary, brachial, radial, ulnar, palmar arch. Now, from the lower limb, continuing on from the femoral artery, let's take a lower limb. See this. Okay, I mean, I wouldn't want to carry it around all day. All right, so here you can see the common iliac, internal iliac, external iliac, and as it courses over the femur, I know you guys can't see this, but that's the femoral artery. Now, it's going to course medially and come out through the backside, and so in red behind the kneecap is the popliteal artery, and then as it continues to descend, same blood vessel in red, it's the posterior tibial. As it courses towards the front from here, this becomes the anterior tibial, this is the perineal. From the anterior tibial, I'll just rotate this around, and there's the anterior tibial artery. Okay, just like I have on the sheet. Then we have the brain. So, looking inside here, we have the spinal cord right here, and on either side we have the vertebrals here and here. The vertebrals are going to merge to form the basilar, so this blood vessel right here is called the basilar, and it's going to give rise to the superior cerebella right here, the posterior cerebral right here, the internal or the posterior communicating here and here, little thin vessels, and the internal carotids. Again, vertebral, basilar, superior cerebella, posterior cerebral, posterior communicating, internal carotid. And let's bring back our torso again. So you can see the axillary vein in the armpit, axillary, coursing over the deltoid. Over here we have the cephalic. You can also see the subclavian vein. This is the jugular vein, and this is a vertebral vein right here. These are the intercostals, veins, intercostal arteries. That I would be asking off of this torso right here. Well, I will also ask for the hemiazagus on the left side in blue, hemiazagus on the left side here in blue, the azagus over here on the right side, and then in between the ribs we have the intercostal veins. Here's the common iliac, there's the femoral vein, and I think that's it. Right? I think I got everything on the list. So just do this.